Hey, what's going on, guys? Jomar Farrales here, Doctor of Physical Therapy. Today, I wanted to talk to you about what to do after a knee replacement. If you didn't see, I had posted a recent video about what to expect after having surgery. And in this video, I'm going to talk a little bit more about what to do after having this type of surgery. But before I go into that, make sure you hit the subscribe button below and hit like, comment, and share this video to anyone who you know is getting a knee replacement or is considering one. Make sure they watch this video. So let's get right into it. Well, one of the first things to do after a knee replacement is pain control. You're gonna be in pain after the surgery, so it's gonna be very important to manage pain so that you can participate in therapy and ambulate and exercise after the surgery. So pain control is very important. This is usually done through medications as well as modalities such as the use of ice or a cold compress, something to that effect after the surgery. So pain medications include something like Tylenol along with oxycodone at times. So it's really going to depend on what the doctor prescribes. Now, these pain medications are, something that I would recommend taking if it helps with modulating pain after surgery, with the goal of obviously not being on them to a point when you're more recovered. So use them initially. It really does help with pain management at first. So I'm not going to tell you not to use your pain meds, especially after a knee replacement. That would just be silly. And so another thing that I think is helpful is icing, especially after a surgery. It's so acute. You definitely want to use some type of ice over the knee. You can leave that on for like 10 to 15 minutes, take it off, wait a little bit, and then you can reapply. You don't want to leave the ice on for too long, because if you leave it on for too long, you might actually get more inflammation from leaving the ice on for too long of a period of time. So that's why they always tell you to ice on and ice off. All right. Another thing that you should do after surgery is definitely ambulate. You're gonna need an assistive device, so a walker is usually what is prescribed. Don't try to be a hero and try to be how you were before the surgery. You just had a major surgery. You have a new knee joint. You want to make sure that you're safe in the home and that you're not stressing that knee too much. So using a rolling walker in the home is definitely something I would recommend for if I had a family member who had knee replacement, just because it takes strain off the knee, especially during that first initial phase. So definitely using a rolling walker, and it helps prevent falls and things like that. So you definitely want to continue using that with the eventual goal of obviously weaning off of that. And depending on what your prior level of function was, transitioning to a cane, then no assistive device, or just from rolling walker to no assistive device. Just really all depends on the patient and what their prior level of function was. So I would recommend probably ambulating every hour to hour and a half. I think that that's something that would be good, just because you really don't want to let that knee stiffen up too much, especially if you're going to be sitting or laying down. I wouldn't recommend laying down in bed after the surgery. You probably want to be sitting up to an extent, in a reclining chair or in a regular chair. Being in bed the whole time will actually probably make your knee more difficult to rehab and get better, just because the body does not like being in bed. So definitely ambulating after or every hour to hour and a half. And when I say ambulating, I mean a short walk from maybe like your bedroom to your kitchen. Do that a few times. It really doesn't have to be anything complicated, but I would just recommend that because it helps with making sure that the knee joint stays loose, but also mitigates any risk factors in terms of DVTs, something like that, developing after surgery, because that is one thing to consider after having a surgery, is there's always a risk of developing a clot. So keep that in mind, but that's what I would recommend. Also, exercises daily. The discharging orthopedic will usually send you home with some exercises on a piece of paper that they recommend, or the PT at the hospital will show you some that you should continue at home on a regular basis, at least once a day. I would do those exercises. I will be making a future video about what the exercises are, but just know that a lot of the exercises include quad sets, glute sets, short arc quads, ankle pumps, basic exercises that are mostly meant to just improve mobility, but also just get the circulation going within the knee and to activate the muscles affected by the surgery. Another thing that to do after a knee replacement is to use TED stockings. These are really good for making sure that the circulation in the lower calves and legs is going as you're sitting, resting. I think that using that is a good way of mitigating any type of DVT. So highly recommend that. If you enjoyed this video, go ahead and like the video and also hit the subscribe button. So yeah, those are the things to do after a knee replacement. I will talk to you